I do have something else to talk about before I get into others. Is an important issue, of course, is the issue of our family care team here in Grand Falls-Windsor. We did release a statement yesterday in conjunction with our health coalition, myself and the chair of the committee, Cyril Farrell. It feels like Cyril and I have had a full-time job on healthcare for the past year or so. We had an information session at the theater a couple of months ago about the family care teams, really trying to help people understand what they were, how you became attached, how they worked. The family care team, in theory, is a really good idea, and it is, in my opinion, and a lot of people's opinions, because it's more efficient. It allows patients to be moved around and less time with people they shouldn't really or don't need to be seeing, and less time on the physicians and the professionals there with patients that they really don't need to be seeing either, just to pass them on to someone else. The problem with the family care team is that it has not been fully staffed since it has opened. So the family care team here in Grand Falls-Windsor opened in November, I believe, of 2023. You know, we're hearing about it and been talking about it for long before that. But we still do not have any family physicians or physicians on that family care team. And there are 2 positions allotted for physicians. And right now we have 1 nurse practitioner and a group of other staff who I know are doing their very best to provide care and to get people connected to a primary care physician, but they're faced with an impossible task. When you don't have full complement of staff, particularly the physicians, they're also short on admin and other things as well, but the physicians being the, I guess, for lack of a better word, the most important, but the other staff are just as important, of course. But how can you get a family care team to solve our issues if you do not have physicians? So we know that we have in our community and close region 4,000 people who are registered with Patient Connect without a family doctor. Now, there was a time in this community that everybody had a family doctor and you could get an appointment in no time, and probably a lot of other communities as well, and we know that other communities are struggling. But for that many patients to not have a family doctor is alarming. And what's more alarming is that since the family care team has opened in November, is that out of those 4,000 people on Patient Connect, there's only about 10–15% of those names that have been connected to primary care. So you can do the math. For the remaining people on that list, it would be years at the current rate before you even get connected to primary care. So something has to happen, and we feel that if the family physician roles could be filled, it could onboard a couple of thousand patients in a very short period of time, which would be a big help. And by the way, those 4,000 people are just people who are on Patient Connect. It doesn't include all the people, and there are lots, who are in this community that I know of who are not on Patient Connect. They either don't know about it or just haven't gotten around to it or whatever, so the number's even bigger. And the problem as we see it, and we've been talking to the local physicians, we've been talking to government, we met with the Minister of Health, we met with NL Health Services, Mr. Diamond. We've been in pretty much daily contact with them ever since, getting updates, and we keep getting told, well, hold off on a release or anything because we're getting close. But it's the same thing every week. So we did release that yesterday, and really that is just one step in what we will move to if we have to, because the family care team has spots for 2 physicians. But the problem is the government's model is not a one-size-fits-all. In different regions, there's different problems, and you need unique solutions. And Grand Falls-Windsor is no different. So what frustrates us most is that we know there are a group of physicians here in our community, many of whom have given up their practices in the last few years here, but chose to stay in Grand Falls-Windsor because they want to stay here and they want to live here and raise their kids here, and which is great. So we have these physicians in our community who are willing to help with the family care team, but they're not willing to apply for and take a full-time position with the family care team. Because one, the remuneration is not what they would get in other settings or doing multiple things such as Emerge, OBS, and that kind of thing. And also the lack of flexibility. You know, these physicians want to be able to do shifts in Emerge. They want to be able to do OBS, as I mentioned. They want to be able to do a clinic in the hospital. They want to do other things so they can give some time to the family care team, a day or two a week maybe. And collectively, we know of at least 8 physicians in the community that are willing to do this. Collectively, they could solve our problem, at least in the short term, and then a long-term solution needs to be had. But when you hear about touting the success of the family care teams and commercials and all that stuff, and we see it's like a punch in the gut when I see that commercial or ad or whatever it is, because we're not having any success with our family care team, and we got a lot of patients without a family doctor, and they're getting underserved, undiagnosed, untreated, and what does that lead to? Obviously serious issues, not to mention the ripple effect on the system, the emergency room overflowing, the health hub overflowing. The cost is enormous. So we really urge government to get this done. When you talk about recruitment, it is crucially important. We get it, and we've been doing a lot ourselves to try to help support recruitment, as we talked about lots here. But why not use some of the incentive money on retention? It makes sense to me, like a doctor from somewhere else or a doctor here really is the same in my eyes. So we have these doctors here willing to help, and we're being told that we need to recruit doctors for the family care team. You can imagine how frustrating that is. So if we don't get a sufficient solution to this soon, we will be going to the next step, which will be public action and a protest or a demonstration or whatever you would want to call it. And we need our community more than ever before. If we have to do that, we need our community to be there, because it's not about us, not about council, not about the town. Technically, this is not even a town responsibility. This is provincial, which is another story I won't get into right now. But this is your health. Like, this is your children's health. This is your grandchildren's health. This is your future. So if we need a crowd, please come out and please help us. We don't want to have to do that. We don't think we should need to have to do that, but we're very close to pulling the trigger on doing that, because it seems like all else has failed, and we still have all these people without any access to primary care doctors right here in the community. So there's a lot more I could say on that and other healthcare issues as well, unfortunately, but I'll leave it at that right now. And if anybody wants any more information on that, they can let us know. The last thing I'll say is that Cyril Farrell, for people who know him, first of all, he's done enormous amount of work on the Healthcare Coalition and on behalf of the town. Enormous amount of work. And he's retired, of course, and supposedly, I tell him all the time, you're supposed to be retired. But Cyril Farrell is a guy who is very rational, very neutral, you know, laid back, not going to get too excited over things and that. Sir O'Farrell has said to the minister, I'm not the type of person to hold a placard, but this time I will. So for Cyril to say that speaks to how big the issue is. And the last thing I'll mention, because we met with the minister over a month ago now, and we really tried to impress upon him the importance of this issue and why they need to change it. So I asked a lot of questions and made a lot of interruptions and everything else at the time to get our point across, but we committed to sending them a list of questions that we want answers to, because we said if we are going to be going out and talking to the media and that, we want to make sure we got the facts. And they said, okay, send in your questions. And I said, you'll have them, you know, in a matter of days. So we sent in a list of questions. At that meeting with the minister, we were promised that the turnaround on the answers to those questions will be fairly quick. Well, guess what? We got no answer, no response, and we're over a month out from that meeting. So, you know, the people of Grand Falls-Windsor and area should be downright insulted by the treatment we're getting. It's not fair. It isn't. And we need to make sure that we stand up for what's right and we get the access to primary care that people deserve.